And as we all are well aware that on Thursday, we are conducting webinar on for infertility series. I'm really grateful to Dr. Kamini Dhimanji, who has initiated and well coordinated this scientific event. So we all are really grateful to Professor Kamini Dhimanji from All India Institute of Ayurveda. And today's keynote speaker is Professor Gayatri Bhatt, Professor and HOD from Hassan, Prasuti Tantra and Stri Rog. Dr. Kamini Dhiman has been kind enough to bless us for second series also. Please do join that series also. That series is on woman wellness. Different topics of woman wellness are included in that particular series. So we are really grateful and to communicate my sincere thanks to all. And I would like to request Dr. Kamini Dhimanji for her views first. In the meantime, our speaker will bless. Kamini ji, namaskar.
Ji, namaskar, Pawan sir. All the dignitaries, all the speakers also have joined over here today, and all participants, and some more to be joined now. We are waiting for a speaker. Although I'll discuss the annual cycle, why we are discussing the topic again and again, that we have started to discuss infertility. But ovulatory dysfunction is nowadays, I have seen that it is very common, and in maximum of patients, we are seeing that ovulatory dysfunction is a major cause of infertility. Whether the causative factor might be lifestyle, a changed lifestyle of the people, or some other causative factors, we can say that doshic imbalance, or sometimes it is due to congenital or bij dushti. We can say that bij dushti comes from sometimes matur ahar vihar or kal garbhashay prakriti, dietary changes of mother during pregnancy of that girl, and that girl when becomes adolescence, or when she attain her maturity, at the time also her ovulatory dysfunction are noticed. And when conception is required, Ritukshetrambu Bij, 4 factors are essential, and Bij is that ovulation. And anovulation is very much common. We give so many times different oral medication, local therapies, oral medications, like sometimes we give to boost rasadhatu. Sometimes we give to calm the mind or to relieve the stress of that particular female. And according to patient or according to prakriti, we can differentiate the causative factor and differentiate our line of management of that particular patient. So we will, I think Dr. Gayatri has joined, and after her presentation, we will take up the questions and we will discuss about the doubts of the participants. Although all are the doctors, all are most of them are gynecological, doing gynecological practice, or our gynecological scholars or speakers. So we will have very good questions from our audience. So welcome, Dr. Gayatri. If you have joined, you can share your presentation. Dr. Gayatri. Otherwise, I will continue with some more medications.
Hello, ma'am. Namaste.
Namaste. Namaste. Welcome.
I joined, ma'am.
Yeah.
Yes. Then share. Share.
बहुत
मैम शेयर हो रहा है ना?
Yes, yes, yes.
गुड इवनिंग ऑल. सॉरी फॉर द डिले. थोड़ा मेरा हाथ भी थोड़ा फ्रैक्चर है.
Oh, ऐसे हो गया.
वैसे ही फिसल गया पैर.
Oh,
तो इसलिए आई नीडेड सम हेल्प फ्रॉम माय स्टूडेंट विद द राइट हैंड ओनली. That's why I was waiting for her to come.
okay, okay, okay.
So thank you for the opportunity, Pawan sir. Always you give me very good topic actually, and female infertility is my area of interest, and since long years. And today I'll be talking on particularly ovarian factors causing female infertility. So we know the definition actually. According to actually WHO has, and when we consider it as infertility, means our acharyas say that actually, especially Kashyapa, he tells both couple should wait till 1 year, and by 1 year they should conceive naturally, swabhavat. Then both of them are dhanya, and they are blessed. Otherwise, both of them should be treated bishajitavyav, like that he has told. So according to our sense, we taking this as reference, we can say that by 1 year, if they are not conceiving, then we can consider as that them as apraja or vandya. And so according to research, till 5 years, according to some research, till 5 years of marriage life, we can give them for consumption. And because for a research purpose, when we take, that is the duration we consider for infertility, like that. So biomedical science 1 year as we do. And but still, if the couple's age is more, or the lady is married or trying married late age, like about 34 years, 35 years, then by 6 months they should try, they should conceive. Otherwise they are considered to be having problem with the conception. So these are the terminologies used in a modern science: fecundability, subfertility study and all. What Ayurveda uses the terms are Vandya, Avandya, or Shandi, Apraja, Sapraja, and all of us know that Harita has considered other types also, like Balakshaya, Kakavandya, Garbhasravi Vandya, like that. So whatever, it's nowadays the clinics or the infertility centers are coming in like a mushrooms growth, because of more and more couple are coming seeking help for the conception. So infertility, according to Ayurveda, is not only limited on non-achievement. Like usually, when we discuss with the modern gynecologist, they say that conception only is the problem when they are treating the infertile people. They just concentrate on the conception, right? She is conceived means infertility is ruled out, but continuous pregnancy is it depends on the antenatal care, like that they will say. But our science, it is not like that. Non-achievement of pregnancy is not limited to like that, but also includes the failure of successful continuous pregnancy leading to birth of a healthy life baby. Till that birth of the baby, and it should like, because in putragni or jatagni jatani jatam hanti garbham. So repeatedly death of a baby, infant death, neonate death, that also considered to be a infertility only. So very much important. We are not That's why whole managing system what we have, like treatment modalities what we use, that aims at having a healthy progeny, that is supraja, and healthy throughout its own life. So how to understand this female infertility is by Hetu, Linga, and Aushadha Jnana. So before knowing to the Hetu or the Nidana of infertility, let us know about the essential factors for Garbha formation. They say that Shukra, Asruk, Atma, Ashaya, Kala, Sampat. So normalcy, that Sampat, the vitality, that integrity of Shukra, Asrak, Atma, Ashaya, and Kala must be there. Along with that, Yasya Upacharascha Hitaistata Annahi. Yasya, for once the Ashruk, Shuddha, Shukra and Shuddha, Ashruk here is ovum, unite together, and Atma enters inside the Ashaya, Garbhashaya, in a proper time. Along with that, when the Garbha is formed, that Garbha should get Upachara of Hita Anna. So Hita Ahara Vihara should be followed by the Garbhini, and then only that Garbha will have birth. Kalecha Sukhi Sukamcha. So without Sukhi Sukamcha, Sukhi, the Garbha is being Sukhi, means Garbha is devoid of any Garbhanga Vikriti or IUG or intrauterine. There won't be and should not be any intrauterine growth restriction. There should not be any Garbhanga Vikritis and Kalecha, and it should not take birth preterm and also post-term, and also Sukamcha means without any complications during labor also. That is the no stillbirth or neonatal death, or no, there should not be any complication even for the mother. No PPH, no APH, or any the maternal health also should be maintained. In such time, Sanjayate Samparipurna Deha. So the Garbha with some Paripurna Deha, without Vikalanga or Una Anga, some Paripurna Deha, completely developed healthy fetus will get birth if Shukra, Asruk, Atma, Ashaya, Kala Sampat is there. These are the essential factors for the Garbha formation. Sudha, who is Sudha? So what are the factors responsible for consumption? There are included under Garbha Sambhava Samagris. Can I stop for 2 seconds, please? Hello?
Yeah, yes, madam. Yes, madam.
Some emergency in a hospital. Only second. I will instruct my colleague to see that, and I'll get back to you, please.
Okay.
Okay, sorry. So Garbha Sambhava Samagris, all of us know Rutukshetra, Ambu Bija. Along with that, Vata Dosha and Hridaya and the Manasa and Chadbhavas and that Marga. Marga means complete reproductive system. All these should be healthy. So along with Shuddha Anila and Shuddha Hridaya. So all these factors together helps in the formation of Garbha. Any defect in any of these factors or singly or collectively leads to infertility. So the causes of female infertility are narrated as yoni pradoshat, asrug doshat, ahara vihara doshat, akala yogat, balasankshayat, manaso abhitapat. So these are the causes for female infertility explained in our science. So what are shukra dosha is considered, can be considered as a male factor, and yoni pradoshat and asruk doshat can be considered as female factors, and manosa abhitapat, bala sankshayat, ahara vihara dosha, nakala yogat can be considered as combined factors. So yoni pradosha, here yoni is not only the birth canal, here complete reproductive system can be considered as yoni. So yoni pradosha can be considered as uterine and ovarian factors, tubal factors, cervical and cervical factors. And I don't want to go deep into this. Uterine factors, you can see in this picture in our hospital only. We did the hysterectomy actually for that patient. So multiple ovarian and uterine fibroids, these are what we can see subserous, and that patient also had intramural fibroids. So when too many fibroids is there, they will give the mechanical obstruction for the formation of garba, as well as whenever there is excessive, whenever there are fibroids, there will be too much hyperestrogenic conditions, so leading to infertility. And other ashaya doshas are septate uterus, bicornuate uterus, uterus, etc. And intrauterine adhesions, Asherman syndrome we call adhesions, and endometrial polyp and chronic endometritis. All this include in causing a female infertility. And cervical factors, actually cervical polyp, yoni arsha, and yoni kanda, yoni arsha, and also like kafaja yoni vyapat, where there will be kandu and pichila shrava will be there. In pittaja yoni vyapat also there will be daha yukta yoni will be there. And in paripluta yoni vyapat, where there will be the dysmenorrhea because of infection in the cervix, there will be deep. So that these are the factors which are causing female infertility. Then tubal factor is most common is factor for causing infertility. We all know that there will be tubal block or hydrosalpinx, etc., which cause female infertility. And coming to ahara vihara doshas. So ahara vihara dosha actually it will cause may cause problems in uterus, problems in ovaries, problem in cervix. That's why we have to give more importance while taking the history on the diet pattern of a couple. So whenever we if a couple are having a habit of taking viruddha ahara, asamyak bhojana, and Amitashana and Anashana, mainly due to nowadays, in different sectors, they tend to run or rush to the office. So in the morning, they may skip the food, or also sometimes even in the busy schedule, like doctors, conductors, or drivers, nursing staffs, or some or maybe those who travel for a long duration, long distance. In such cases, they may even the lunch time also one or two the annakala also they may skip. So these type of things cause the ahara dosha. And nowadays they also take more of processed food, junk food, and the more of that food are nowadays fast food what we eat are having more Ajinomoto, which is very dangerous in reproductive health is concerned. And too much of ice creams and sweets they are taking nowadays. The sugar is very bad, which causes which hampers the the functionality of growth hormones. So they also cause a problem in the ovulation. And if there's a n number of such factors, if we see, they are causing the problem in conception is concerned. Especially they are all factors responsible for causing anovulation or different types of ovarian problems. Then avyayama, ati vyayama, both are very dangerous nowadays. The youngsters are going to gym, so aerobics gyms, okay, in some extent they are doing good, they do exercise. But if you compare it with our yogasanas, practice of yoga is far better than this gym, because it looks like ati vyayama. Whenever they are not, they like a fashion they are doing now, whether their energy matches or not, without, or their prakriti matches or not, they without considering their prakriti and deha, I mean their bala, they are doing this type of exercises that is also leading to ovulatory type dysfunction. And avyayama, all of us know, sedentary way of life style causes obesity, that indirectly or directly leads to anovulatory cycles. And Vevaya dosha also cause, if they don't know how to practice the coital act and time and the position, etc., and that also leads to infertility. Then manasika bhavas like krodha, shoka, bhaya, irsha, etc., along with Ratri Jagarana, Diva Swapna. These are all the factors responsible for causing any type of female infertility, especially anovulatory cycles. And we know that we are actually in Ayurveda, Rajaswala Charya or Urut is explained. And if it is not followed, because it is nowadays we are not able to follow this, that also causing the infertility. Because during Rutumati, Rajaswala, or during this period, there will be a vata, apana vata is very much active, and and all the energy of body is directed or concentrating on the lower part of the body, that is towards the reproductive system, and other body parts should rest. That's why Agni also during this period, Agnis are so very low. Hence, the very light food like Laja or the Yava Anna should be given, that to half stomach. But nowadays, irrespective of their menstrual cycle, ladies, they consume any type of food, whether they digest it properly or not, without thinking of that, they will consume. And also, this is the period, 3 to 5 days, the lady should rest, because she should not give more work to other parts. But nowadays, during menstrual cycle also, they travel, they play games, and they athletes, they run. So these are the reasons why slowly that is causing problem with the ovulation. Then ahar vihara dosha causing the abnormal BMI, it causes. And in athletes, abnormal BMI also. And in athletes, too much of vata aggravation happens when during menstruation also, if they practice that. And another point is garbhopakatara bhavas, like if a mother consumes the garbo upaghatakara bhavas, that during pregnancy, teratogenic, or the bija dushtikara aharas during her pregnancy, then in her the garbhakara bhavas, the bija bhaga avayava, which is responsible for the formation of follicles in the female fetus, if it is affected, then the born baby, if it is a female, then it will get polycystic ovarian disease, which is inherited by her mother. So very importantly, during pregnancy also, we have to monitor the proper diet. Then Akala Yoga, it is one of the reason for female infertility. Bala Sankshayat also. So due to apatya sevana and avatakara ahara vihara sevana, and due to some vyadis, chronic illness, hypertension or thyroid dysfunction or diabetes, etc. Vyadis also, there will be too much of bala. Bala here can be considered her physical strength, or also we can consider bala as immunity or autoimmunity also we can understand in deeply. So that will be affected, by which the there will not be conception. Is that okay? Am I connecting to you? Hello.
Yes, madam. Yes.
Shall I continue?
Yeah,
yes. तो change करूँगी.
No, continue.
Okay. So this Bala Sankshaya, hence we can understand it, the immunological factors like SLE and antiphospholipid syndrome associated with the RPL, that is a repeated pregnancy loss, and endocrine factors, that are thyroid dysfunction and diabetes mellitus, PCOS, LPD, and infectious causes like cervico-vaginal infections and torch infection and anemia. So these all collectively or singly we can understood as a Bala Sankshaya. So 12.8% of female population reported to have ASA, antiphospholipid antibody, and 26% of female population have reported to have thyroid disorders. Recent this. And then Manasabhitapat. So we know that in our science it is told that Saumanasyam Garbhadhanam. For the Garbhadhana to happen, both the couple should have their mind stable mind or healthy mind mentality or the mind status, because at the time of coitus, it is told by our Acharya that Kshudita, Pipasita, Bhita, Vimanaha, etc. These conditions, if they have a coitus, then the born, there will not be conception, and this, if they conceive also, the born baby will not survive longer. So that keeping mind in a healthy status is very, very important. And even during Garbhadhana also, so throughout the pregnancy, it's very important, because we know that stress induces, stimulates the hypothalamus, is directly affect gets affected by the stress, and because of that there will lack of pulse of GnRH secretion. Due to that, there will be anovulation. So we have to always keep we have to counsel the couple to have a healthy mindset. Then what is the role of Vata in female infertility? So we know that Vata, Vayu, Vibhu, it does all the the functions of the body. So carrying of rasa and or burning or the pachana of the food is also by the Vata, because Samano Agni Samipasta, and also the formed ahara rasa will be taken throughout the body by the Vanavata. Like that, each and every function of our body is by Vata. Since Vata always should be respected, and Vata Prakopakara ahara, Vata dushti should be prevented. And also it is told that nahi vata drite yoni narinam sampradoshyati. So without vata, there will not be any yoni vyapat. That means in all yoni vyapat, even in a vipluta yoni vamini yoni vyapat, where there is that there will be yoni will vomit the shukra without bija, bija. That means after the 6th or 7th day of its entry. That means before it gets implanted, the embryo will come out, or sometimes blighted ovum also. Without bija it will come, blighted ovum also we can understand. That means this condition is understood in clinically as luteal phase defect, where there will be anovulation and the progesterone hormone will be very low in a serum, leading to implantation problem. So vata is responsible for the garbha akriti. So when vata only having problem, garbha will not form. So Vayu Garbecha Garbe Nashecha Hetu. Hence, Vata should be respected and Vata should be under the control. So coming to our main topic today is Asruk dosha, which is also understood as Asruk. Here is not only blood. Asruk in this context is we can consider as a ovum or the stri bija. So ovarian factor, 30% of female infertility is caused by the ovarian factors. And the core component in the evaluation of the infertility is ovarian factor. We all know that follicular study we check, because bija is responsible, very much important factor for the conception. And the condition like polycystic ovarian disease syndrome, or the disease where the ovaries ovaries are affected. So in Asruk dosha, what are the Ayurvedic condition we can understand is Nashtartava, Kshinartava, Vamini Yoni Vapat, Asruk Dhara, that is anovulatory bleeding we can understand, Anartava and Artavakshaya we can understand. Or another is, if we are considering the morphology of the ovary in case of PCOS, then Dimba Granthi also we can, or Kafaja Granthi or Kafaja Dimba Granthi or Granthi we can understand. So what are the ovarian factors or the problems causing female infertility? Are the polycystic ovarian syndrome, primary ovarian insufficiency and anovulation, and diminished ovarian reserve. So along with that, thyroid dysfunction. We know that thyroid directly causes the ovulation dysfunction. So what are those conditions where we get ovarian dysfunctions? Are ovarian cyst. Whenever there is a ovarian cyst, maybe dermoid cyst or functional cyst or simple cyst, whatever may be the cyst in ovaries, whenever there is a ovarian cyst, there will not be ovulation. And ovarian tumors also, there will not be any ovulation. Endometriosis, especially in endometriomas or a chocolate cyst of the ovaries, that will also directly affect the ovulation. And scarring from the surgery, if there is any previous surgery is done, then maybe by for polycystic ovaries also, if drilling is done, that also may there may be scarring in the ovaries, or like. So there also, or maybe ovarian cyst is removed and only cyst is removed, ovaries is left, and that there also there may be scarring will be there. That also in a long term leads to anovulation. Then pelvic inflammatory disease. So whenever there is a pelvic inflammation is there, inflammation may reaches up to the ovaries, and there will be adhesions, and there will not be ovulation. So whatever may be the cause, how to evaluate the couple when they visit us means by taking detailed history about their diet, very important, their lifestyle, because Ahara, Nidra, Brahmacharya are the more three pillars of Ayurveda, where we need to give more emphasis, we have to emphasize more on this. So history should be taken. about their pattern of work and how their physical exercises and their sleep pattern, work pattern. So whether they are having faulty food habits, and because when we take detailed history of that, Nidana Parivarjana will be helpful, and we can have a customized diet prescription for our couple, and diet also lifestyle prescription for our couple, so that Nidana Parivarjana they can do, and which adds or mainly Sankshepata Kriya Yoga Nidana Parivarjana. 50% or 80% of treatment will be problem will be solved just by correcting the Nidana. So that's why we have to take detailed history. Then physical examination, general examiner Dasha and coming to Roga Sambandhi Pariksha also we have to do gynecology examine, perspicular examination, very much important. Hello?
Yes, madam. Yes, continue.
Okay. So because we know that if like ovarian dysfunction, especially we get hirsutism more. So hirsutism is atiloma. Atiloma is one among the Ashtanindita Purusha. When you say Ashtanindita, that lady is Nindita for the conception. So that's why physical examination, ati sthula, asti nindita, ati karsha, because sometimes even always ovarian dysfunction ladies will not be obese. Sometimes very the karsha also will be there. Krisha lady also will be there. So physical examination very important, and on for acne vulgaris and for acanthosis nigricans, for everything we have to do the thorough examination. Then though we are Ayurvedic doctors, we can treat without investigations also, without scanning also, by Dashavida, Ashtavida Pariksha, by understanding her Agni and Prakriti, and Deha Prakriti, and her Roga Prakriti, and her Sattva, and Jarana Shakti, Vyayama Shakti, and Nidana Panchaka. And when we understand Nidana Panchaka and draw the Samprapti, we can do, and properly we can do the Samprapti Vigatana. But as we are living in a modern era, taking the help of investigations like scanning or blood investigation, it will help us to give particular treatment for patient satisfaction also sometimes we needed, and we are answerable also. And when they ask, we need to be in a position to defend ourselves, so that in that kind we can take the investigations. Otherwise, if we don't want, if we can if we can convince our patient without investigation we can do, then surely without investigations also we can proceed with for the treatment. Because in my practice I won't give much importance for that, all this AMH, follicular study and all, whatever the reports they have, I will just go through and start the treatment. One investigation very particularly I do it is one abdomen pelvis scanning, and 2 to 3 cycles treatment also when she is not conceiving. Then tubal factor to know that HSG hormone I will always HSG X-ray histosalpingogram tubal to know the tubal patency I will do. Otherwise I give very less importance for all these hormonal essay. But it's nothing wrong if we get it done, because whatever the report we get, our ultimate the treatment will be panchakarma, and our formulations, either the formulations only give, taking the factors like desha, kala, vaya, agni, prakriti, all these factors. Hence investigation is not that much important. So history, medical and surgical history, sexual history, personal and lifestyle history, all this history should be taken, especially menstrual history. That because if we understand that ovulatory, the cycles, there will be frequent menstruation. They may get once in 15 days, 20 days, within 25 days they will get the menstruation, or intermenstrual bleeding they will get, or prolonged bleeding also will be there, or irregular menstruation also will be there. So menstrual history is very much important. So age, occupation, exercise, stress, dieting, changes in weight, smoking, and alcohol use, all of which can affect directly the fertility. So we have to take history properly. And so to assess the ovulation, we have to do investigations, and to assess the ovarian reserve, and also to assess the tubal patency. So ovulatory function assessment, by taking the menstrual history, we can, just now I told, understand her ovulation pattern. And we can do follicular study on the 10th, 12th, and 14th day. Sometimes 16th and 18th day also we may need. In some ladies, they ovulate delayed. And serum progesterone, urinary LH, endometrial biopsy also can be, to know whether secretory endometrium or not, or and to know the basal body temperature. By this we can assess the ovulatory function. So to know the assessment, to know the ovarian reserve, whether their follicles are there, then FSH, AMH, and TVS can be helpful. Then coming to Chikitsa Sutra. So here the Vandya, or the Vandyatva, or the female infertility, it's ovarian factors. This is Asruk dosha. So Chikitsa Sutra, we have to follow Daiva Vyapashraya, Yukti Vyapashraya, and the Sattva Vajaya Chikitsa. So Antar Parimarjana, that is Shodhana. Shodhana, especially which is told in Garbhadana Samskara only are told, and in all the Arthava Dushya and Venu Appats also show as a Shodhanartha, the Panchakarma is told, that can be, we can adopt. So according to the condition, we have to select the type of the Shodhana, whether Virechana or Anuvasana, whether Basti or Vamana. And also Snehanatha medicines also very much important. We have to customize, and according to Prakriti and Deha Prakriti and Rogi Prakriti and Roga Prakriti, we have to decide. And so Shuddha Yoni only Garbham Vindati Yoshitaha Yoni. So Evam Suddhashu Yonishu Garbham Vindati Yoshitaha. So Shuddha Yoni is very much important. Yoni is complete reproductive system. So to make it divide of all the abnormalities, the Panchakarma is the main line of management here. So that's why Panchakarma treatment should be adopted in all infertility cases. So Panchakarma, we know that it does the dhatu level detoxification does. So Dhatwagni also gets stimulated, and it also helps in regulation of HPO axis, thereby regulates the ovulation, and also it helps in the regeneration of endometrium, and it does the Shroto Shodhana. Hence even the tubal patency also can be achieved by giving proper Panchakarma. So mainly why I am telling here, as and Samprapta I could not explain here. So whenever there is Kafakara or Kafakara Ahara Vihara is done, then Kapha Dusha, the Mandagni will happen. Due to that, there will be Ama formation, and Ahara Rasa also will not be properly formed. So thereby, as a Upadhatu of Rasa is Arthava is Upadhatu of Rasa, that is also not formed properly. So if Bijarupi Arthava is not formed, then it leads to anovulation. And sometimes Vatakara Ahara Vihara, due to that also there will be Agni Vishamata, Agni Mandyata, because Samana Vata is also not functioning properly, then that also leads to Ama and not forming proper Bija Rupi Artava, leading to anovulatory cycles. So whenever we find there will be Kapha Bahulyata is there in that patient, and amenorrhea is there, and Artavakshaya is there, and in such cases we can give Vamana. Even anovulatory cycles are there also, where there is prolonged bleeding, there also we can consider it's Adogata Rakta Pitta, and we can adopt Vamana, because Vamana is removes the Saumya Dhatu, Saumya Bhava, which is there in the Artava, and also which induces the Agnayatva, and thereby the clearing the Shrota Rodha, and thereby inducing the ovulation. Then coming to Virechana, in the Virechana action, mode of action, it is told in the end only, Bijam Bhavati Karmukam, the Bija which is having the problem in its functionality, it's the Garbhakara Bhava of that Bija is having defect, then by giving Virechana, it will be helpful. And here, if the female is having if woman actually, if there is the Alpartava is Kshinartava and amenorrhea history, Anartava history is there, then Vamana will be very helpful for inducing the ovulation. And here regular menstrual, regular flow, or and also there will not be any ovulation, then in such cases Virechana will be helpful. And Basti, actually, it is helpful in the Nashta Pushpa and Yoni Shula and all. So, Nashta Pushpa, if we consider this ovum, then if loss of anovulatory cycles, in anovulation, the Basti will be helpful. Then coming to Nasya. So, Nasya, once again, Nasya helps in correcting the HPO axis. So, hence, it will be very much helpful in inducing the ovulation, because it acts directly on the brain and pituitary, because Nasohi Sirasodharam Dwaram, we know that through that the route it will stimulate the anterior pituitary, thereby there will be proper secretion of pituitary hormones, and will be helpful in correcting the HPO axis. Then coming to a very beautiful, unique management is Uttarabasti. And here we know that anovulatory salka in Satapushpa Taila and Shatavari Taila, Kshara Taila, Lashuna Taila, these are all helping us to treat anovulation by giving Uttarabasti. So, do I have time?
Yes, madam. You continue.
Okay. So whether we have to give all the Panchakarma therapies and Stanika Chikitsas and Shamanoshada, or only few can be used. That only I can say that depends on the the bishop, and also depends on the condition on our patient. So case studies: a female with significant obstetric history of molar pregnancy and ectopic pregnancy reported to the OPD with the married life of 6 years and anxious to conceive. So married of 6 years, during these 6 years, she had lost 2 pregnancies, because first one was diagnosed to have a molar pregnancy, and after that again she conceived, and it ended up in a ectopic pregnancy, that ectopic twin pregnancy actually. And when she came to me, she had very classical polycystic ovaries with very thickened stroma. So, and she was with irregular menstruation and sorry, it is wrongly written. Menstrual history was not normal, irregular menstrual history, and but other investigation are normal. Only polycystic ovaries were there, and we gave her actually virechana because she was not her prakriti was vata pitta, and she was not at all ready for vamana, and sattva was also avara sattva, and they were very new to Ayurveda. First time they were taking Ayurveda treatment, they were not at all ready for, convinced for vamana. Then we gave her mrudu virechana actually, and Snehapana. For that Shatavari Ghrita was selected, and from the 5th day of menstruation, I admitted that patient. Deepana Pachana with the Musta Haritaki, Guduchi Trikoti was given for 3 days. Then Shatavari Ghrita, Arohana Krama, Snehapana was given. Then we gave her virechana with the avipatti churna 40 grams with the draksha kashaya, and she had 13 vegas, and with the samsarjana karma advice we have discharged the patient. And after that 2 cycles she got regular cycles, and male factor was normal, and they were very young couple actually. They were Marwadis, and she was just 22 and husband was just 25 years, and married 6 years. So very early age only. Actually, nowadays we cannot say this also. Almost POXO case, right? So it was the 2008-7 that time. Okay, so she conceived, and at the age of I think 23 she conceived, and had a healthy male baby. And after 2 years of that baby, again she started with the irregular menstruation, and because their family, so joint family, they had a business, they want to have one more baby, but because of her the busy schedule, she could not come for panchakarma. Had given her shamana ushadi, but she did not conceive. This can be considered yoni pradosha. Second case here, actually 27 years girl with irregular menstruation, and here also polycystic ovarian syndrome was there, and married life 4.5 years, and here also we gave virechana for her, and she gave birth to a male baby. This was also actually this girl had come before marriage also. She had come to me and with heavy menstrual bleeding, and that time only she got actually diagnosed with her PCOS, and told her parents to arrange her marriage as early as possible, because and she was obese also, and her parents actually tried, and she got married. But after marriage, once again she had irregular menstruation. She found very difficult for the consumption. But thing is, before marriage, regular menstruation, but heavy menstrual flow she used to have, and after marriage, irregular menstrual with the normal flow. So that is only the difference we got, and but after virechana she got conceived. So this is asruk dosha. Then here yeah, this all about hello madam. One
Yeah,
more
yeah.
is
Yes, yes, ma'am.
that are the other causes. Here another case here, PCOD. Once again we gave vamana in this case, because the lady was having irregular menstruation, and also though she was having 3 to 4 days, but moderate flow was there, but there was no clots, and other complaints was not there, but only multiple ovarian follicles was seen. And as she was 32 years, and we know that married since 5 years, and that as the late 30s, right? Later 30, after 30 years, once again the fertility will decline. So we admitted her. We had given udvartana for her for 5 days. During Udvartana, we gave her Panchakola Fanta for what you call Deepana Pachana. Then we gave her Vamana. Before I admit her, actually, I had given, she came with amenorrhea and amenorrhea for 3 months, and I had given her Artavajanaka, Aushadis, Rajapravatini Vati, Kumaryasava and all, but she did not get a menstruation. So during that amenorrhea period only, we had planned her Vamana, because Anartava, amenorrhea is Anartava, and Anartava is Margava Rodha, due to Margava Rodha, due to Dushita Kapha, like so this to remove this Margava Rodha, we planned Vamana. So in that case also, actually, she, after follow-up only 1 month, she like 3 months amenorrhea, we gave Vamana. After 15 days, she came once again. She did not get periods. Then once again, we gave her Varaja Pravartini Vati and explained to take Tilakashaya early in the morning. Then she got her periods. Then every month we called her for follow-up, and third follow-up she conceived, actually. So another case of Artavakshaya where we gave Vamana, and here once again she is a 28 years lady, and this is scanty menstrual bleeding. She had very scanty menstrual bleeding. And here Falagrita we gave her for Arohana Krama, and here also we gave her Vamana, and she had 7 Vegas, and she conceived after Vamana, she conceived. And another actually, this is actually Garbhashaya dosha, but where we had to give both Vamana and Basti. So these are different. Any doubts?
Yeah, we completed, madam.
Yeah, ma'am.
Oh, so we will take up the questions if anybody want to ask. You pose the questions, and then I'll ask to madam if anyone want to ask the questions.
I hope I have not taken too much time.
No, madam. No, madam. We are having sufficient time to have discussion on the topic. Yeah. But thank you that you are not feeling well. Even then you are presenting.
It's okay, ma'am. It's my pleasure.
Yeah. Somebody has sent me the personal message. You asked about chocolates to madam.
Okay.
Yeah, I think you have mentioned in your presentation.
Yeah, I mentioned. So
yeah,
it is very difficult. Actually, what happens now, we Ayurvedic people, we end up in comparing the modern condition, and we read from reports the modern condition. Then we break our head to in which condition, for which condition we have to compare, so that we can have the treatment. We need not to compare with any other, the condition with the modern and Ayurveda. Should not get confused. So what is chocolates is, it is endometriosis, right? So collecting in the ovaries and having a problem in it is causing the ovulation problem. So if you, because now we have a scanning, they have told the chocolate cyst, it's a collection of that menstrual blood. You can take a raktada or gulma or raktaja, what you call raktaja gulma or granthi, you can consider. Otherwise, in vataja yoni vyapat, in Vagbata he said, which vapta yoni in the beginning, if it is not treated in time, right? So then Nidana Parivarjana is not done, and it is not treated, that symptoms is not treated. Chirat gulmam jayate. So chirat means in chronic conditions, that vataja yoni vatat will become a gulma. Here gulma in the reproductive system. So indirectly we can understand this endometrioma or a chocolate cyst as a gulma in the dimbha or the reproductive system. For that, what we have to treat? So Vataja line of management. So give Virechana, classical Virechana, then Basti and Shamanaushadi. It will be helpful. One of my patient actually, she was just 27 years when she got married and tried for 1 year, and no, not 20, 25 years I think. And 1 year they tried, and they went for modern doctors, diagnosed to have a very huge bilateral chocolate cyst. And they gave her for 3 to 4 months some the oral medication they suggested surgery. Then they did laparoscopy surgery, and they did the lysis of the ovarian, the endometriomas. And after that, till for 1 year, they gave her ovulation induction. And when she did not conceive, again the symptoms like menstrual cramps and severe pain she used to get in the lower abdomen, mood swings, and all pitta lakshanas she used to get. Okay, this is what she told in history. I have published this case actually. So, and once again they did her they did scanning, same recurrence of same size of bilateral endometrioma. Once again, second time they did the lysis laparoscopy surgery. They followed with the ovulation induction for 1 year. Again, after 1 year, third time she got the ovarian, endometrioma. Then when again they were very much sorry for the girl, but the option was surgery. Then in that hospital only, one of my student was doing as a duty doctor, and she suggested her to meet me. But when the patient came to me, she was not ready to, she was not at all Bishakvasha and Adhyarogi. Both were not there. She had run out of money, no patience, and family of the in-laws were angry on her, and she had no patience also. And when I told complete Panchakarma plan, she was not ready to listen to me, started crying. And she thought it's a burden for her, and she thinks that some magic I have to do. But still, okay, I said, I cannot guarantee the treatment, but okay, I will tell my student, one of my student, to support you, so that you just I gave her complete plan of the treatment. And because her neighbor nearby her house, one of my internee used to stay her home. So I called the internee to my clinic. I explained everything and treatment and all. So I told her to take ghee ghrita snehapana from her house. Go to that doctor house every day morning, take ghrita and massage at her home only. Let her take by herself and take a Ushnodaka Snana. And I gave her actually this one, clear, the Nagarjuna companies clear out tablet, 2 tablet. And she had 8 to 9 Vegas only. But after 2 days, after Samsarjana, for 3 days, she came back and she was so happy. She said she had all the Pitta Lakshanas, anxiety, everything was almost 40% reduction was there. Then I was not at all not much interested, because she was not listening to my instruction, not ready to buy any medications. And I had samples of Emtutone tablet and Punarnama Mandura, something simple medication I gave her, and to complete diet plan I told her. And after third cycles, she came with the positive result. And that means our treatment, simple Virechana, also had cured the bilateral tumors, endometriomas, and scanning, nothing was that. And that day, sorry, I'm telling some story here actually. When she got, she was, I think 7 weeks, she started with spotting. I was out of station, and she called me and about she's getting spotting. Then where she was showing the I called one of my modern doctor, gynecologist, and to attend her night, no. So she needed scanning. So she told her house was nearby, beside her hospital. My gynecologist friend, because my patient, when she reached at midnight, 2 o'clock, she went and took the scan, and she called me and told that everything is fine. It's just a placental bleeding. Anyway, I will admit and give Prolutan injection and all. But why I'm telling this story, that doctor was surprised to see that lady conceiving, because he called me and told, this is my patient. I had done twice a laparoscopy surgery for her, and advised third time surgery. And what you gave? What is that virechana you gave? And she conceived. So this was the beauty of virechana. And when we see the report, scanning report, most of the time we think that we cannot treat it. Something else. It is not Ayurveda. We cannot treat. But definitely we should not go back by seeing this type of thing, because because of oxidative stress, this type of thing happening. So when this panchakarma treatment acts as antioxidants, and definitely it will be helpful. Thank you.
Okay, madam. Another doubt is about role of Nasya for an ovulation.
Yeah, Nasya, actually, if you can give Brangaraj Swarasa Nasya. Brangaraj is very Tikshna, but in polycystic ovarian syndrome, it helps. Because I said, Naso hi Sirasodwaram, it stimulates the anti-repetitory, thereby it helps. But Pratimarsha Nasya with Mahanarana Taila also will be helpful in treating the anovulation.
Other than that, madam?
Shatapushpa.
Okay.
Nothing is available, Anutaila.
Okay. And another question is not regarding ovulation, but there is Nasya in amenorrhea.
Hello?
Yeah, madam. Nasya in amenorrhea.
Amenorrhea.
Yeah.
To get menstruation, madam.
Same thing, madam. That if patient ovulates, there will be menstruation. Otherwise, there will be amenorrhea, right?
Yes. But what happens? No. When the patient is in amenorrheic condition, I have not given Nasya so far. I have given Vamana, Basti, then Nasya.
Okay. The prior to that Shodhana is must, and then Nasya can be
Very good, ma'am. Just if you can give Sadhya Vamana also got a Sadhya Virechana, it's also, I mean, Smrudo Virechana also you give, that's fine. Or Nitya Virechanas you give, that is also okay. But Virechana is, Shodhana is very much needed.
Okay. And another doubt is about anovulation due to thyroid dysfunction.
Thyroid, actually, what is thyroid? We consider Agni, right? So we have to Agni, the correction of Agni only should be done. So it is not that easy actually. But repeated Shodhana and Chitrakadivati, or that what you call Panchakola Fanta. There are different types of thyroid dysfunction we see, like hypothyroidism, hypothyroidism, asymptomatic, symptomatic,
thyroid
already
dysfunction
affecting the
related to an ovulation.
That hypothyroidism. Yeah, hypothyroid means Agni Mandya, because of Agni Mandya, Agni Dushti. So there once again Kapha Bahulya will be there. So better we have to give Vamana in such ladies. And Patya Apatya should be followed always.
Okay.
Thank you. Ma'am.
Yes, madam.
I have to rush to hospital.
Okay.
I told no that time on the emergency.
Yeah, madam. Okay. Okay, madam.
Anything you can give my number, they can WhatsApp me. I will
WhatsApp,
I will correct.
They can ask, but one or two questions are there only. If you can have 5-10 minutes, then we can have. Otherwise, it is up to you.
Actually,
Yeah. I take opinion of other experts. Thank you, madam. No
Thank you.
problem.
Thank you so much. Thank you, Kamini madam, Pawan sir,
Yeah.
all IRES, this one association. Thank you all for the opportunity.
Okay. No, madam. No problem, madam. Thank you so much. I'll take up the opinion of other experts. So we are having Kripa Patel, Diksha Katuria. If you want to add anything. Diksha, Kripa.
Uh, Good evening, madam.
Good
Uh,
evening. Your
uh,
expert opinion upon innovation.
Not an
Mention.
expert opinion, madam, but I want to share my experience regarding anovulation and amenorrhea, both.
Yes.
हाँ, अभी हमने जो बात आप अभी किसी ने पूछा कि ये एमेनोरिया में नश्य दे सकते हैं या नहीं.
हाँ.
एज वी नो एमेनोरिया इज बिकॉज ऑफ एनोवुलेशन. अगर ओवुलेशन होगा तो एमेनोरिया नहीं होगा, लेकिन एनोवुलेटरी मेंसेस भी आते हैं. तो अगर कोई पेशेंट आता है जिसको हिस्ट्री है, जिनके साइकिल ही लेट आती है, मतलब 2-2.5 महीने पे, या सिर्फ विड्रोवल लेने पर ही मेंसेस आते हैं, ऐसे
बहुत
पेशेंट में
आजकल
हाँ
बहुत पेशेंट्स आते
बहुत
हैं.
बहुत बहुत ही पेशेंट. और ये ओनली बिकॉज ऑफ विड्रोवल वाले पेशेंट तो बढ़ रहे हैं, और वो भी विद इन 25 to 35 ईयर एज. इतने ही
हाँ.
एज में ये हो रहा है. तो ऐसे ऐसे पेशेंट में मैंने अभी थोड़ा ऐसा काइंड ऑफ रिसर्च जैसा एक स्टार्ट किया है कि मैं देखूं क्या कर सकते हैं. तो पहले हम इन जनरल रूटीन पहले तो दे देते थे रज प्रवर्तनी वटी, आरोग्यवर्धिनी, दशमूल वात वगैरह. और अगर मोस्टली ऐसा होता है कि ऐसे पेशेंट अनमेरिड है, स्कूल गोइंग या कॉलेज गोइंग है, तो वो पंचकर्म करवाने के लिए नहीं आते, तो दे आस्क फॉर ओरल मेडिसिन ओनली. तो फिर और एसी मेडिसिन से हमने देखा कि नहीं, इतना अच्छा रिजल्ट नहीं मिलता है. मतलब 15-20 दिन, महीने तक लेने पर भी मेंसेस नहीं आता है. तो फिर मैंने थोड़ा ऐसा मॉडिफिकेशन किया कि इनको मैं सीधा ले जाती हूँ पहले दीपन पाचन पर, आइधर चित्रकादी वटी या फिर शंखवटी. और ये जो मैडम ने कॉम्बिनेशन बोला गुरुची हरित की मुस्ता त्रिकटु वाला, वो या फिर मुस्तादिक, तो उनको 1 हफ्ते का दीपन पाचन कंप्लीट, वो खुद बोले कि मैडम मुझे भूख लग रही है अब ज्यादा. वो होने के बाद मैंने नस्य स्टार्ट करवाया. शतपुष्पा तेल से नस्य, जो हमारा क्लासिकल है. मतलब पहले अभ्यंग स्वेदन करो सुबह में उठ के, ये एम्प्टी स्टमक आफ्टर जस्ट ब्रशिंग. आई आस्क देम टू डू द नस्य अभ्यंग विथ तिल तेल और इफ पॉसिबल महानारायण तेल. देन रूटीन जो स्वेदन हम लेते हैं वो, और फिर दोनों नॉस्ट्रिल्स में 8 ड्रॉप सतपुष्पा तेल, बिकॉज वो हमारे यहाँ इजीली अवेलेबल है, तो सिर्फ यही तेल का नश्य करवाती हूँ. और अगर रूटीन जो गले में आ जाए तो फिर निकाल देना है और गर्म पानी पी के कुल्ला कर लेना है. और 1 घंटे तक कुछ भी खाना नहीं है. अगर पीना है तो गर्म पानी पी सकते हैं, लेकिन खाना या नहाना कुछ भी नहीं. 1 घंटे तक थोड़ा रेस्ट करना है. हाँ, ये मैंने सिर्फ 7 दिन के लिए दिया. कोई पेशेंट में 5 दिन के लिए और कोई पेशेंट में 7 दिन के लिए. और फिर बोला कि आप 5 दिन करके बंद कर दो, काइंड ऑफ विड्रोवल जैसा. और मैंने मैडम कम से कम अभी तक, ये मैंने लास्ट 6 मंथ से स्टार्ट किया है ऐसे पेशेंट में, तो अभी तक 4 से 5 पेशेंट में ऐसा हुआ है. फ्रॉम 10 पेशेंट के 5 दिन देने के बाद जैसे विड्रॉल करते हैं, मतलब बंद करते हैं, तो विद इन 3rd और 4th डे उनका मेंसेज स्टार्ट हो जाता है. हाँ, अब मुझे ये पता नहीं है कि कैसे काम कर रहा है. मैं इसे ले रही हूँ क्या, हम जैसे प्रोजेस्टेरोन या कोई भी हॉर्मोन्स का विड्रॉल देते हैं, कि वो दिया और बंद किया, विड्रॉल होने से मेंसेस आ गया. तो मे भी कुछ ऐसा हो रहा होगा नश्य से, कि हाइपोथैलेमस कहीं से स्टिमुलेट है कि कुछ हॉर्मोन्स सीक्रेट कर रहे हैं, और एंडोमेट्रियम में कुछ विड्रॉल जो नहीं हो रहा था, वो सपोर्ट मिलके विड्रॉल हुआ और ब्लीडिंग स्टार्ट हो गया. तो हाँ, ये एक एक्सपीरियंस है. अभी मुझे पूरा नहीं मालूम है, ये सारा डेटा इकट्ठा कर रही हूँ कि कौन कौन से पेशेंट में क्या क्या कंडीशन थी. हाँ, नो डाउट, साथ में मैंने रज प्रवर्तनी और चित्रकादी, ये 2 ओरल मेडिसिन कंटिन्यू रखी है. लेकिन नश्य सिर्फ 5 दिन देके बंद कर दो, तो तीसरे या चौथे या मैक्सिमम 5th डेट पर उनका मेंसेस स्टार्ट हो जाता है. तो ये एक एक्सपीरियंस है कि एमेनोरिया है, और एनोवुलेशन भी है। तो और फिर मेंसेस आने के बाद फिर उनको कन्विंस करके मैं बस्ती पे या विरेचन पे जैसी जैसी कंडीशन फिर ले जाती हूँ। लेकिन पहली बार मेंसेस लाने के लिए ये एक अभी थोड़ा ये काइंड ऑफ एक्सपेरिमेंट किया है।
उन पेशेंट्स में फिर अब ये फॉलिकुलर स्टडी करा के देखो कि आपकी ट्रीटमेंट जो विदाउट दिस
हम्म।
नस्य दिया जाता है एंड
ओके।
आफ्टर दिस नस्य अगर आप जो सेम ट्रीटमेंट देते हो, क्या
हम्म।
पेशेंट पे इफेक्ट आ रहा है कि नहीं, है ना?
हाँ हाँ, अनमेरिड है तो मैं फॉलिकुलर स्टडी शायद न करवा पाऊँ, लेकिन
हाँ
अगर
हाँ हाँ
मैरिड है तो मैं
हाँ
पक्का ये, हाँ, ये अब ये भी कराऊंगी कि इसकी इफेक्ट इस पे आती है या नहीं है।
हाँ, कि आपने
हाँ।
बस्ती वगैरह प्लान किया है, योग बस्ती जैसे हम देते हैं
हम्म
एनोबुलेशन में,
हम्म।
तो ये नशे देने के बाद दिया तो क्या ओव्यूलेशन पे इफेक्ट आया? ये नशे नहीं दिया, फिर हमने योग बस्ती दिया तो क्या उसमें कुछ चेंज आ रहा है कि नहीं आ रहा है, वो हम फिर अपना डेटा जो स्ट्रांग हो जाता है ना?
पक्का पक्का,
हाँ,
यस मैडम, श्योर।
नशे देने के बाद अगर हम योग बस्ती देते हैं तो हमें एनहांस्ड रिजल्ट मिल सकते हैं, मतलब ये हम ऑथेंटिसिटी के साथ बोल सकते हैं अगर ऐसा
यस
हमारे
यस
पास प्रूफ रहता है तो, है ना?
यस यस यस
ये
मैम,
करके देख सकते हैं इसमें इन
यस
पेशेंट्स में,
यस।
है ना? हाँ
अदरवाइज इन जनरल हम यहाँ पे एनोवुलेटरी फैक्टर है जो क्लियर कट फाइल लेके आते हैं जिसपे पता ही है कि एनोवुलेशन है, तो उनको योग बस्ती के साथ साथ भी नश्य देते हैं। पहले
हाँ।
मैं नहीं देती थी, पर यहाँ पे जो एक्सपीरियंस हुआ पेशेंट में, क्योंकि इतनी ओवरी मतलब रेजिस्टेंट हो जाती है कि उनको सिर्फ बस्ती नहीं, उनको नश्य भी देना पड़ता है। तो 8-8 10-10 ड्रॉप तक हम उनको बस्ती के साथ नश्य देते हैं और ओव्यूलेशन होता है। और हमने तो अभी अभी देखा है कि दोनों ओवरी में से ओव्यूलेशन हो रहा है। तो
हम्म।
मतलब इतना सपोर्ट देना पड़ता है। हाँ। तो
हाँ
ये तो मतलब हमें अब इतना स्ट्रांगली बोल सकते हैं, एस्टेब्लिश्ड हो गया है कि नहीं, योग बस्ती और नशे तो ओवुलेशन होता ही है।
हाँ,
ये
होता
ये
है,
तो है।
मतलब ये कि एविडेंस अगर जनरेट करना है तो फिर ऐसे
हाँ।
कॉम्बिनेशन, हाँ कॉम्बिनेशन से कर सकते हैं कि हाँ कॉम्बिनेशन देने के बाद चेंज आता है कि नहीं आता
यस
है,
यस मैम।
वो देखना चाहिए, मतलब, है ना?
यस,
हम्म
श्योर श्योर मैम। थैंक यू।
हम्म।
Excuse me, ma'am. Can I ask one question?
या श्योर 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 श्योर।
मैम, वो जो नशे देते हैं ना, हम वो 8-9 ड्रॉप्स तक भी देते हैं, पर वो एक्चुअली हमें इसी डे से स्टार्ट करना है ओवुलेशन करवाने के लिए, ऐसा कुछ है क्या मैम? जैसे कि 7th डे 8th डे से स्टार्ट करना है या फिर 10th डे के बाद करना है?
10th डे के बाद करेंगे तो कैसे बेनिफिट होगा ना, है ना? अभी अभी जो बात हो रही है वो विड्रॉल के लिए एक्सपीरियंस उसने शेयर किया, बट अदर देन विड्रॉल अगर आपको देना है तो आप जस्ट पोस्ट मेंस्ट्रुअल स्टार्ट कर सकते हो, है ना?
5th 6th डे से ही हम स्टार्ट कर
हाँ हाँ,
सकते हैं
बिल्कुल,
मैम?
बंद होने के बाद ही स्टार्ट। 10th 12th डे पे तो ओव्यूलेशन ही हो जाएगा ना बेटा, है ना?
हाँ वही मैम, वो एग्जैक्ट
हाँ
मतलब हमें मतलब रूल्स ऐसा ऐसा कुछ है नहीं ना, तो फिर हम देते तो है एक्चुअली, पर कुछ पेशेंट में काम करता है, ओवुलेशन होता भी है और कुछ में होता नहीं है मैम, 15th 16th डे तक भी नहीं होता है, इसीलिए।
हाँ, उसको फिर आपको कॉम्बिनेशन करना पड़ेगा ना, जैसे बता
हाँ
रही
मैम,
हैं।
बस्ती और
हाँ
वो हाँ चल रहा
हाँ
है, पर फिर भी
हाँ।
हो नहीं रहा है, तो उसमें कुछ विरेचन करवाया था हमने पहले, फिर
हम्म
उसके
हम्म
बाद बस्ती और नश्य
हम्म
साथ में करवाया था, 3-4 मंथ तक कंटिन्यू किया, पर फिर भी उसका एक बार तो बना था फॉलिकल, ट्वेंटी
हम्म
थ्री
हम्म,
तक बना, पर ओवुलेशन हुआ नहीं। फिर नेक्स्ट
हम्म।
मंथ मैम 18 से ऊपर जा नहीं रहा है वो।
हाँ, तो इस पेशेंट में जो जैसे तुम बता रही हो ना कि ये सब देने के बाद भी वो फॉलिकल का साइज बढ़ गया काफी, 23 तो काफी ज्यादा हो गया ना,
हाँ
तो
मैम।
इसमें क्या विबंध की हिस्ट्री है क्या आपके पेशेंट में, वो एक्सप्लोर करो,
मैम
है ना?
गैस का उसका रहता है, गैस का तकलीफ, वो
हाँ।
हम मेडिसिन तो देते हैं, पर वो दूध भी वगैरह ऐसा कुछ पीते हैं ना, हम दूध
हम्म।
मेडिसिन के साथ बोलते हैं, तो उसको तुरंत ऐसा गैस वगैरह फॉर्मेशन हो जाता है।
हाँ, कॉन्स्टिपेशन की हिस्ट्री, उसको थोड़ा सा नित्य विरेचन जैसा कुछ देख के फिर करो बाकी थेरापी एक साइकिल में, है ना?
जी मैम।
नित्य विरेचन दे दो, थोड़ा सा नित्य विरेचन, जैसे एरंड
हम्म।
स्नेह से नित्य विरेचन, या उसके कोष्ठ के अकॉर्डिंगली आप विरेचन ड्रग कोई भी डिसाइड कर लो कि अगर पित्त वाला उसका कोष्ठ है तो विपत्तिकर से भी हाई डोज देके विरेचन हो जाता है।
हम्म।
अदरवाइज एरंड स्नेह से भी अगर आप विरेचन देते हैं तो वो भी
जी
उसमें बेनिफिशियल रहता है, ओव्यूलेशन पे भी काम करेगा, और इसमें कोष्ठशोधन करके उसमें बेनिफिशियल होगा उस पेशेंट में। तो उस पेशेंट के कोष्ठ वाला इशू है, जहां तक मुझे लग रहा है, जो हिस्ट्री जैसे बता रहे हो ना कि
जी
नस से
मैम।
काम नहीं कर रहा, ये भी नहीं हो रहा है, और थोड़ा सा बड़ा साइज हो रहा है, तो कोष्ठ पे काम करो उसके, है ना।
जी मैम, ऐसा नित्य
हाँ
विरेचन।
मैम पूर्व कर्म जो है ना वो ठीक से, जैसे अभी मैडम कह रही थी ना, हमने दीपन पाचन किया, नस से किया, रिजल्ट मिल गया, तो शोधन की क्रिया तो हो रही है, बट उसके पहले प्रिपरेशन कैसी है, हो सकता है वहां पर कुछ गड़बड़ हो, जिसकी वजह से
हाँ
जी मैम।
बराबर शोधन क्रिया हो रही है,
वही,
लेकिन पूर्व कर्म प्रिपरेशन ठीक से नहीं हुई बॉडी की।
हाँ उसके
थैंक यू
कोष्ठ
कृपा
पे
मैम फॉर योर नाम।
कोष्ठ
जी
वाला
मैम।
इशू है, उसका कोष्ठ ठीक नहीं है पेशेंट का,
हम्म।
है ना, तो कोष्ठ पे
ओके
काम
मैम।
करो।
तो 1 मंथ
हाँ
हम पूरा प्रोसीजर बंद करवा के दीपन पाचन और अनुलोमन ही उसको चालू करवा
हाँ
सकते हैं ना?
हाँ हाँ,
हाँ
क्योंकि
जी
उसमें वात का इन्वॉल्वमेंट है, बट ड्यू टू अवरोध है ना।
मैम। जी।
हाँ, ड्यू टू अवरोध है, तो अवरोध आपको दूर करना पड़ेगा, अग्निमांद्य है, उसका अग्निमांद्य ठीक करना पड़ेगा, उसके बाद आपकी मेडिसिन काम करेगी उसमें, है ना।
जी।
हाँ,
थैंक यू मैम।
हेलो, गुड इवनिंग मैम। मैम एक
गुड
क्वेश्चन है
इवनिंग।
मेरा भी।
जी जी जी।
मैम पर मेरा ये इससे हटके है थोड़ा सा क्वेश्चन,
हम्म,
कि एक पेशेंट है, उसकी टोटल थायराइडेक्टमी हुई है 1 ईयर बैक।
हाँ अभी क्वेश्चन मैंने पढ़ा था, वही तो
हाँ
मैडम से
हाँ
पूछा
हाँ।
था,
तो
वही तो
उन्होंने तो
मैंने
सिर्फ
मैडम से
ये बताया
पूछा।
वमन, उन्होंने तो वमन के बारे में बताया ना बस,
हम्म।
मैम ने तो बट फिर
वही
मेरा यही पूछने। हाँ जी।
वही क्वेश्चन मैंने उठा के उनसे पूछा था,
हाँ
कि हाँ थायराइड डिसफंक्शन है इस वजह से, तो
हाँ
उसमें
जी।
क्या करेंगे ऐसा। हाँ वही वही
हाँ
मैंने
तो
पूछा।
वो मुझे मिला नहीं ना उसका जवाब, इसलिए मैं शायद आपसे एक सोच रही हूँ कि शायद
हम्म
कुछ आप बताएंगे मुझे। तो इसमें
हम्म
मुझे यही पूछना है कि चांस है कंसीविंग के या नहीं, क्योंकि पेशेंट यही पूछता है आके बारी बारी। वैसे भी
हम्म
थायरोक्सिन पे चल रहा है पेशेंट।
हम्म।
तो उसको मैं क्या कहूँ कि भाई हो सकता है कि नहीं हो सकता है, क्योंकि
ओव्यूलेटरी
मेडिस
डिसफंक्शन।
नहीं अभी तो ऐसा कुछ नहीं है।
हम्म
तो पेशेंट अभी मेरे को पूछ रहा है कि हम ट्राई कर रहे हैं, तो ये हो
हम्म
सकता है कि नहीं, क्योंकि वो इसी चीज से डरी हुई है कि जब मेरा ये हो ही गया और थायराइड फंक्शन मेरा खत्म हो गया तो फिर मैं कैसे कंसीव करूंगी। तो
हम्म
मैंने उसको बोला कि ऐसी बात नहीं है, कि जिसका नहीं
हम्म
भी होता है हाइपोथायराइडिज्म में भी या हाइपर में भी पेशेंट की दवाई चलती है, तो वो
हम्म,
कंसीव कर जाते हैं, बट थोड़ा टाइम लगता है। बट मैं फिर
हाँ
अपनी नॉलेज के लिए भी आपसे यही पूछ रही हूँ कि तो मतलब चांसेस तो होते हैं ना मैम।
हाँ बिल्कुल बिल्कुल होते हैं, ओव्यूलेटरी डिसफंक्शन है कि नहीं है वो चेक कर लो ना।
हाँ वो चेक
ओव्यूलेशन
कर
हो रहा
लेंगे।
है, हाँ ओव्यूलेशन हो
हाँ
रहा
हाँ
है नहीं हो रहा है,
हाँ जी
तो
हाँ जी।
हाँ ओव्यूलेशन अगर हो जाएगा तो पेशेंट कंसीव हो सकती है आराम से,
हाँ
कोई
क्योंकि
दिक्कत।
क्योंकि पेशेंट यही श्योरिटी मांगता है पहले, सबसे पहले आके, क्योंकि है ही
हाँ
केस
वो
ऐसा
तो
ना।
है,
तो
वो
फिर
तो है
पूरा
ही।
दोनों कपल आके ऐसे ही बोलते कि नहीं मैम पहले आप ये बताइए, अब दे देते हैं, बट फिर भी मैं थोड़ी सी कंफ्यूज हो गई, मैंने कहा मैं कह तो रही हूँ, बट पता नहीं पेशेंट को अगर नहीं मिला रिलीफ तो पेशेंट आगे वापस कह देगा तो थोड़ा गड़बड़ हो जाएगी, इसलिए मैं थोड़ा कंफर्म कर रही थी मैम से ना। और उन मैम का एक
हम्म।
बारी नंबर भी प्लीज मुझे चाहिए था, आप दे सकती
हम्म।
हैं तो।
हाँ
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 तो मैं थोड़ा,
बिल्कुल बिल्कुल।
हाँ हाँ, थैंक
हाँ
यू
हाँ
मैम, थैंक यू
हाँ
वेरी मच।
हाँ ठीक है। सो और किसी का कोई क्वेश्चन है तो हम ले सकते हैं, 1 मिनट अपने पास